Hi, and welcome to our podcast. I'm Brent Dodge, and I have with me physical therapist Leah Versteegen, a physical therapist here at Alpine Physical Therapy. And our topic today is going to be the physical therapist approach to the lower chain. We're going to define that term in just a minute. We'll talk about the lower chain and how it relates to our overall function. So Leah, when you're working with people and they come in and they may have a pain complaint, what is it that you're looking at when you think about the lower chain?
Well, Brent, oftentimes we have people come in with a sprained ankle or some sort of a diffuse pain. They can't really explain it, something going on in their hip. And what I often look at is not just where the pain is coming from, but I have to look at the leg as a whole, starting up at the pelvis, where the pelvis meets the back, down through the hip, knee, and ankle. So the lower chain is the combination of all the joints together.
Yeah, I really like that term, the lower chain, because it describes something that's interconnected. And I think that's the idea that we want to express to our watching audience, that one point connects to another. And so they're all relevant when it comes to defining where that pain is coming from. What are the things that when you're working with clients in physical therapy that you see a lot that would help the viewing audience know what they might expect if they were to have physical therapy?
One of probably the most common, I don't want to call it an abnormality, but one of the most common presentations that I get that does not present the lower chain in its proper alignment is when somebody's hip either drops or their knee comes in. A lot of people would call that knock-kneed or bow-legged. So a lot of times they think, oh, that's just the way that I am structurally. But what they don't know is sometimes the positioning of the leg all comes from the proximal or the upper muscles, the upper joints. So how your hip is rotated can affect the position of your knee, can affect the mechanics down at your ankle, and vice versa from the ground up. You have to look not just at the ankle when you have an ankle sprain, but up at the hip, at the knee, maybe even the low back. Make sure you screen and make sure that there is not a deficiency in the low back that is causing pain down the chain.
So somebody who comes to physical therapy and they've got an ache or a pain in one part of their lower chain shouldn't be thrown off by the fact that you're going to examine all the way from the lower back through the hip, knee, ankle as part of your evaluation and treatment?
Yep, that's right. I have a lot of patients who look at me almost like I'm crazy when they come in after they have knee pain or after they've just sprained their ankle out on the soccer field or the basketball court. And I screen their ankle first, definitely, where the pain is coming from, find out what has happened with that injury. But then I always look up at the knee and look up at the hip, and again the pelvis and the low back, to make sure that there is not some sort of a weakness or a muscle imbalance, a joint imbalance that has caused the weakness or the sprain in the ankle.
You know, and I think the lesson for the viewing audience is that we are more interested in fixing the real culprit. Finding the culprit, fix the problem, as opposed to just addressing where that pain may reside. And I think one of the most keen examples that I've seen in the last 20 years as a physical therapist is a person with chronic back pain who comes in, and the next thing they know, I'm working on their foot, and possibly from an old ankle sprain, they've got a little bit of a bony alignment in what is called the cuboid bone. We can actually manipulate that bone and change the way that whole chain works, taking pressure off the structures in the low back. Next thing you know, they're feeling better. Are there any particular things that you see commonly that you would address in these kinds of situations?
Brent, that's a great example of how the lower chain can be changed from the ground up. From the core back down to the ground, there's also many examples. For example, the gluteus medius, which is a muscle just kind of underneath the big gluteus maximus muscle. When it weakens, your hip rotates into an internal position, and that can cause your knees to buckle in, can cause that knock-kneed position, cause knee pain medially or underneath the kneecap. It can also cause pain all the way down the chain, leading to structural changes in the foot and ankle with presentations like plantar fasciitis or even recurrent chronic ankle sprains.
It really sounds like the physical therapist needs to be kind of a private investigator when someone comes in with sort of a pain complaint that's not really obvious, to be able to find out about these muscle imbalances and other changes that need to be addressed. And that would probably lead us to our tip of the day, which I think will be very helpful for our listeners today as they think about the lower chain.
Here's today's tip of the day. A simple exercise you can do at home, requires no equipment whatsoever. I want to explain a couple things that you want to look for, so maybe doing this in front of a mirror would be helpful. Lindsay, go ahead and stand on one foot. Keep your knee bent just a little bit. Always make sure it points straight ahead, over about the second toe. You're now going to tap your other foot out to the side and forward. Coming back to center each time, going along different poles like there's a star underneath you. You want to make sure your hips stay level, your trunk stays upright, and your body stays nice and still, focusing on that lower chain. Ankle, knee, and hip, nice and stable.
I'd like to give a special thanks to physical therapist Leah Versteegen, a physical therapist here at Alpine Physical Therapy, for joining us and talking to us about the lower chain. If you have additional questions on this or other topics, be sure to visit our website at www.alpineptmissoula.com or call us here at the South Clinic, which is in the Peak Health and Wellness Center, at 251-2323.